The goal of our study was to really look at the effect of this policy change and try to validate scientifically if it did what we hoped it would do.
A new study focusing on children suffering from a concussion found that earlier rehabilitation services can significantly help recovery outcomes following a protocol change in institutional policy surrounding concussions. Speaking with authors of the study, Elizabeth Teel and Isabelle Gagnon, they say these policy changes see significant benefits.
The benefit of a policy is it's creating sort of a standard, and it's helping to create those intentions and put them into action. So by having this plan, it's more likely that you're providing sort of a positive pressure that, people will follow this plan.
The Montreal Children's Hospital's concussion clinic changed its internal policy in 2017 to include a 2-week maximum delay in its protocol before some rehab sessions could begin. Following the changes, results showed that children who started treatment earlier recovered about a week faster than those who started treatment later.
1 week might not feel like a huge amount of time, but when you have a headache, when you're nauseous, when you can't see your friends, when you're not doing your sports, when you're feeling isolated, a week is a lot of time to young children.
Gagnon noted professionals suggest resuming physical exercise after only 24 to 48 hours, depending on the patient, encouraging cycling or running.
The general approach for kids with concussion is don't rest too long. Take a couple days to, get yourself back together. Then activate yourself, meaning that, get up, walk around, do chores around the house, get gradually more and more active. But the main message, I think, is don't hesitate to consult.
Both authors encourage healthcare facilities that treat concussions in children to start looking at implementing similar policies.
What we're recommending based on this study is that each facility should look within their own resources and come up with what is the best policy that they can provide given those resources at their own environment.
Gagnon notes that these recommendations are already in the works at the Ministry of Health in Quebec, and it can be feasible to implement. Teel echoes the same sentiment.
What we want to see is that people take the time to have a thoughtful plan in place so that we can get these children the best treatment as early as feasible and help them get better as quick as we can.
In Montreal, Tehosterihens Deer, City News.